All right, class. So we're going to pick up from the last slide that I was talking about. The video got cut off, so this is going to be part two to the lecture. And we were just talking about how we can prevent or maybe treat overtraining for athletes and just some things that we can recommend to our coaches. Um, After overtraining, usually athletes are going to deal with burnout, and this could be physical and emotional. It can lead to negative self-worth, and it just stems from overwork. And this happens to not just athletes; it can happen to anyone with their work when they're putting in too many hours, not getting enough rest. Um, they don't have time to recover, so their performance is not going to be at the best. There should always be a good balance to how much work that they're doing. So some of the things that you're going to notice are GI distress, frequent headaches, sleeplessness, and chronic fatigue. Some of the other things that they could experience are depression, cynicism, emotional exhaustion, and then also a reduced sense of accomplishment. So anytime you're seeing this, it's usually a good sign of burnout. And as an athletic trainer, you may even experience this yourself. And someone from at your work or a coworker may tell you, hey, like, you look like you're burned out, you look like you got too much on your plate. And I think as an athletic trainer, you have to be aware of that, and you have to see that in your athletes as well, making sure that they're not getting overworked. And just some things that we've kind of already covered here that you can read. Um, Psychological factors in the rehabilitation process. So make sure that you have a good report, that you have good cooperation, and learning. Making sure that the athlete is aware of the their whole rehab and then what portion of the rehab they're in. Obviously, you don't ever want to just give just a blatant statement as far as when they're gonna return to play, um, and and the type of performance that they're gonna have when they return to play. You don't want to make any statements that you know where you're trying to make promises just to help them feel better, because that's I think that's being irresponsible. I think you should definitely set goals, um, but always just reminding them, like, hey, look, this is our goal. We're gonna try to get as close as we can to that goal, but never promising anything. You want to make sure that you're truthful and that you're encouraging, and that you're not leading them to believe that they're gonna return to play and immediately, and that they're gonna start playing at the level that they were playing before. So we'll pick up here on this slide, like I was talking about, the positive effects of just setting goals. And I think you have to do it in a certain way. Like it says here, it's an effective motivator for rehab compliance. It should be progressive and should be attainable goals. You can set daily, weekly, or monthly. I always like to pick out a certain date, a certain game that they would want to come back to play in. And this is a joint decision. It's not like letting them pick, like, oh yeah, I want to play in that game. You want to make sure that you're kind of reeling them in a little bit, because they're probably going to pick the soonest date that they feel they can do. But you may have to tell them, like, look, that doesn't seem reasonable. We need to go a little bit further out. We'll shoot for that game, but no promises. Just let's make that our goal. Let's see if we can make that goal. Some factors for goal setting: they have to be specific and measurable, positive versus negative language. Like I said, challenging but realistic. It has to be a reasonable timetable. And then as you continue your rehab, you want to monitor and evaluate those goals. So if you're a couple weeks out from the date that you guys had set that they were trying to play, and you notice like, man, their range of motion still isn't back, their strength isn't back, they can't really move like they should, then maybe we need to push that date back and kind of start anticipating that they're not going to make that date, and just start letting them know that. It says if a goal is not reached, reevaluate the goal. May have been overambitious. Was there a complicating factor that hindered the goal from being reached? So just make sure that you're constantly communicating with the athlete, keeping them positive. So we're going to pick up here at mental training techniques. There's going to be several that we cover: meditation, progressive relaxation, refuting irrational thoughts, thought stopping, and imagery. So we'll go back up here. So for meditation, just some things to remember about this technique is focusing on the constant mental stimulus. You can say a certain phrase or a sound or a word. Use a quiet environment. For progressive relaxation, it's a technique that a lot of professionals use, and you practice this alone, and where you're tensing up muscles and then you relax them. So you tense for 5 to 7 seconds and you relax 20 to 30. And depending on what sport, you can repeat this for specific areas. And I know that there's certain athletes that will do this right before they'll do a performance, and they shorten it down. They try to make it like a little bit quicker so that they have time to do it, and they get into a routine of doing this. The next couple things are refuting irrational thoughts. So this is just some positive talk. This is like what it comes down to, just kind of telling yourself positive things. Thought stopping is to stop any negative thoughts with positive self-talk. So similar to the previous one, but here anytime you have a negative thought, you're just saying or verbalizing it, telling it to stop. And then for imagery, this is also very common in athletes, a technique that they use. So visual rehearsal, so thinking of a problem, then the solution, and then they see themselves succeeding. And then the emotive rehearsal portion of it is like visualizing a scene of positive feelings that are associated with the competition. And body rehearsal is more specific towards injuries, so just visualizing your body healing, and this is where you can kind of come in and help out a little bit, because if you can explain some of the anatomy and physiology of their injury, they can start visualizing what they want to heal, what specific body part. Okay, here we'll pick up with concussions. Like it says here, concussion is defined as a blow to the head resulting in one or more of the following symptoms. And actually, it doesn't have to be a blow to the head. It could actually be just any force that's going to move your head in a quick and violent manner. So that could be you falling on your shoulder. It could be getting hit on your shoulder, on your side. It doesn't necessarily have to be getting hit directly on your head. As long as your head is moving and then comes to a quick stop, such as like an accident, when you get rear-ended, you get whiplash, and that can cause a concussion very easily, because your head is moving, then it stops, but your brain continues to move inside your head and your skull, and so it'll hit the side of the skull. Some symptoms to note: headache, nausea, vomiting, dizziness, balance deficit, fatigue, difficulty sleeping, drowsiness. All of these things are things that I'll talk about a little bit later, but just as it refers to testing. So some mechanisms of injury are coup, counter coup, torsion, and rotational. So coup is just the initial impact that causes brain to the trauma. So if you got hit in the front of your head, then that's where you'll get the irritation or disruption to the tissue in the brain. It will be in the front of the head. Counter coup is rebound on opposite side, causes trauma to the brain. So if sometimes when you get hit on one side of the head, it may just cause the brain to get pushed back and hit the other side of the brain. So most of the injury will be caused to the opposite side of the brain, or both. But either way, what this is referring to is just um, sustaining injury to the opposite side of the brain of where you initially got hit. And then torsion or rotational is a brainstem being twisted um, by a rotational blow to the head. So, like if a boxer gets uh, punched on his chin, that will make their head twist violently, and that rotation causes the brain to again hit the side of the cranium. Here's another definition to be very aware of. A concussion is a diffuse ionic disruption throughout the brain. So what we need to know here is when we're trying to diagnose a concussion, and then also some of the steps that we take. One of them is when we see severe symptoms. So if someone has retrograde amnesia or anterograde amnesia, if they lost consciousness, as an athletic trainer, we're gonna refer them to see a doctor, to go to urgent care. Now, we're not sending them there so that the doctor can tell us, yeah, this person has a concussion, because to this point there really isn't a test, any kind of imaging, anything that can tell us or that can diagnose a concussion. What we're sending them for to get an MRI or a CAT scan is to see if there's any actual physical damage. So if there's any internal bleeding, if there's any bruising, if there's any fracture to the skull, that's what we're sending them for. We're not, MRI, CAT scan can't tell you if someone has a concussion. Um, we're basically diagnosing concussions based on symptoms, and that could be physical symptoms, physiological, or cognitive symptoms. And like it says in that bullet point, cognitive and neurological tests will help determine deficits. And then it says severity is determined by the amount of dysfunction and symptoms occurring with the patient. um, and then the last bullet point there says loss of consciousness is not a marker for severity. And that used to be how we graded concussions, was just if they lost consciousness and how long they were unconscious. Now that's not really going to tell us severity. So for concussion assessment, cranial nerve um, test, memory, executive functioning, fine motor, balance, and exertion. All of these things are included in some of the tests that we do. At CBU, our policy requires that the athlete score within 95% of their baseline score on 4 different tests. One is the CSI, one is the BEST, which is a balance test. Let me back up. The CSI is a concussion symptom inventory. So basically, we're marking off points for how many symptoms they have, and then the severity of those symptoms. The BEST is a balance test. So basically, we're testing the athlete's balance in different positions. We also have a standardized concussion test, which um, has some cognitive tests in there, has some memorization and um, things of that nature to test mostly how they're doing cognitively. And the last test is our impact test, which is a computer test that will um, test not only cognitive but also executive functioning, like it mentions there in the PowerPoint, and then also just um, speed of the speed that they can react, or how fast they can answer certain questions. In our last slide here, as far as recovery, the main thing to know is that balance and cognitive functioning are the last to recover. So that's one of the things that you're going to notice, that they're not going to be recovering from very quickly. That could be one of the very last things. So as far as concussions goes, that's the main thing that you're going to need to know. For the final, it's going to be 25 questions, multiple choice. The last 2 are going to be matching. So just make sure that you cover all of the PowerPoints. If you have any questions, please let me know.